Hello everyone, this is Dr. Shmama Tuzara, and today our topic of discussion would be infections of the central nervous system. So this is a very interesting topic, and that's very fascinating for pathologists when we see infections and organisms under the microscope. So this is going to be a lot of fun. So let's start. This was my presentation during my rotation in neuropathology department at University of Washington. So these are gonna be the overview that what would be the points we will discuss in this video. So this is our fifth video on the series of infections of central nervous system, and today our topic of discussion would be Naegleria fowleri. What does it cause? It causes primary amebic meningoencephalitis. So that's gonna be the topic of discussion today. Moving on, just the scenario. So we start the discussion and start our whole case. So it's a 25-year-old woman who present with acute onset of headache and lethargy. So macroscopically, the brain would appear swollen, and extensive hemorrhage and necrosis would be there, as seen in these images. This is swollen heart with all the vessels prominent, and this is the whole hemorrhage seen here. Hemorrhage, also necrosis here. So this is how it would appear macroscopically. So how the disease and the organisms they look under the microscope. So they would be scanty mononuclear inflammatory infiltrate with focal hemorrhage in the meninges, and extensive necrosis of brain parenchyma would be seen, and Naegleria fowleri amoeba, they are present in the subarachnoid spaces and around the vessels in the necrotic parenchyma. So this is the characteristic picture of it. Now I would show the images. And then the brief description of how Naegleria fowleri would look like before we proceed to the images. So the diameter is 8 to 15 micrometer, and it's slightly less than Entamoeba histolytica A. Secondly, it can look like Belamuthia or Acanthamoeba, but the difference is that Naegleria fowleri is almost never encysted, while Belamuthia is almost most of the time it's encysted. Okay, and then third important point, that it do resemble macrophages, but how we can distinguish it from it, that it has a vesicular nucleus, it has large central nucleolus, and the macrophage markers CD68 and HAM56, they would be negative here in Naegleria fowleri, and of course positive there. So this is how we differentiate both, and this is the image of that typical focal hemorrhage and mononuclear neutrophilic inflammation. So this is the neutrophils everywhere, inflammation with these red areas with the white arrows shown. These are the focal hemorrhage seen. And Naegleria fowleri amoeba, how this image shows that these organisms, organism with the central nucleolus, vesicular nucleus, they are seen in the perivascular space around the vessels in gray matter of the brain. This is again in a good description of that. Blood vessels, these are all the group of Naegleria fowleri organism, so present in the perivascular space in gray matter of the brain. This is the zoomed version of it, like at very high power you can clearly appreciate the organism with their vesicular nucleus, prominent nucleolus. And now they can also be seen within the Virchow's Robin space. I'm sorry. So what is the Virchow's Robin space? It's basically a fluid filled structure within the brain, and they surround the small blood vessels when they move from the subarachnoid space into the brain parenchyma. This is the space, fluid filled space, basically provide cushioning, I think. And this is an again good image of that, how it looks like in the higher power version. This is the virtual space, and this are those clear organisms. Now, wrapping up, just to understand the disease, this was our whole case, Naegleria fowleri causing primary amoebic meningoencephalitis. Now, how it is caused, Naegleria fowleri is basically isolated from freshwater, soil, sewage, heating, ventilation or air conditioning unit, dental units, GI washing, and dust. How it is transmitted by swimming in fresh water which contained the amoeba, or inadequately chlorinated pools from there, and it is not associated with any pre-medical condition. When it is maximal chances to occur or more common is the hot summer months. And amoeba, so it infects the nasal cavity and then it spreads to the CNS through the cribriform plate. Here we have at the base of the CNS, I think. So this is how it works. The disease occurs. Now, how it would present? So it's an acute fulminant, it's a rapidly fatal illness that can affect previously healthy children or young adults, and onset from exposure in water to the disease start is like 5 to 7 days. And how patient would present with meningitis, and that rapidly progresses to even coma and death within 48 to 72 hours. And patient may have seizures or any focal neurologic deficits in his presentation. And that's all for today. I would like to thank my attending and my co-fellows. I'm sorry, who gave me the opportunity and helped me a lot in making the presentation. And this is the building of University of Washington, a nice click which I took, just a memory. So thank you everyone, I hope you liked it, and if you did, please tell me in the comment section and do share it with your friends so that it help everyone. And do share me your feedback, correct me out if you feel like or that I did something wrong, or any suggestions of your new topics you like from me to make videos on. And yes, stay tuned. Series of infections are going on. I think we're left with two more, so stay tuned. Goodbye. Take care.